Classix 1079 with Jay Dixon. As I have conversation with folks, especially with brothers, the conversation comes up about prostate cancer because we either know someone in our family, a friend, or someone that has dealt with that challenge. So one great opportunity we have here is to talk to Dr. Lee from Penn Medicine. How you doing today, Dr. Lee?
Not too bad.
No, we really appreciate you being here today, sharing the information. So, as black men, what should we know about prostate cancer? What's the first thing that should pop up in our mind?
Well, 100%. I think the first thing I would really encourage people to know about it is that it is a highly curable and survivable disease. This is one of the most curable and survivable cancers that we have around, but the trick is to get an early diagnosis. And the second thing is just to know your risk. We know that prostate cancer does strike a little bit harder among Black and especially Afro-Caribbean communities. So our brothers from Jamaica, from Trinidad, et cetera, we do want to make sure that we pay close attention to those.
So what is that age that we should start thinking about getting tested?
Yeah, so this one is for the more seasoned of us, not so much for the young folks, but we usually recommend starting screening at 45.
Great. What are the differences when we talk about prostate tests?
So the blood test, there are good things about it and bad things about it. It is not 100% accurate, but it's one of the more accurate tests that we have these days. And we usually use that blood test as a first step for this whole process. The rectal exam, I mean, listen, nobody likes having those types of exams, right?
Mm-hmm.
It's not a pleasant thing, but it is one of those things that is part of the normal exam. I would say that for screening or for checking in, it is not 100% necessary, meaning please do not let the fear of that exam dissuade you from coming in for a screening. I mean, it's just very simple to say, hey, listen, I just would appreciate it if we didn't do that. Please just give me the blood test. That's something I actually encourage a lot of our patients to think about so that they at least get some testing.
Dr. Lee, thank you so much for sharing that information today. And, we will be making sure that our listeners can catch the rest of this interview in its entirety at classixphilly.com.